All right, so a lot of discussion as to the state's budget in the final few weeks of legislative session. Senate's back in today. The House is off, but they have 2 weeks left of spring session. And one of the big things they got to do is pass a budget and how to spend your tax dollars. Well, one of the things that's a focus is healthcare costs and how the state's going to cover Medicaid costs. While there's matching federal dollars for most of that, a lot of other spending is only going to get state tax dollars, not federal matching tax dollars. And that's the policy when it comes to the state offering up fully subsidized medical benefits for certain undocumented migrants. And the estimated cost continues to grow for that line item. And State Senator Dave Syverson from the Rockford area, he took to a podium yesterday to readdress these overall costs and his concerns as to how this is going to eat away at some of the other much needed programs that the state of Illinois needs to spend on. Here's Dave Syverson.
We have for a number of years advocated for fully funding the most vulnerable in our population, which is the DD community, our developmentally disabled community, as well as our seniors. Those are two groups that continue to be shortchanged every year, and the excuse has always been, well, we don't have enough funding. Well, last year, the majority party and the governor chose to expand health coverage for undocumented in Illinois. The results we raised a year ago was that this was going to open the floodgate and that this was going to become a financial burden. The state at the time said no, this was going to be a couple $100 million cost, and the state could absorb that in their existing budget. That number has grown dramatically. When the governor introduced his budget just a few months ago, they were talking about a couple $100 million cost that would affect some 10,000 individuals. A month ago, they revised that number and said, no, as a state, we're going to be covering those undocumented, age 42 and older, that number had risen to 52,000 individuals to be covered. Last night in the hearing, in just a matter of a month in the hearing, they came back and revised that number now to a staggering 120,000 undocumented will be covered just on the age of 42 and older, with now the latest estimate cost of $1.1 billion, of which nearly $900 million is not in the budget. Clearly, this is going to be a budget buster. These costs are going to continue to skyrise as Illinois is the only state in the nation that fully covers health care for undocumented from age 42 and older. When they're crossing the border and they realize they have health conditions, they know there's one state to come to if you have health issues. Illinois now, because of the policies of this state of being a welcoming state, is now being inundated with every sick individual from around the country that's coming here. We shouldn't have expected anything different when you're the only country and you're the only state in the only country that has an open border for health care. Something significant has to be done. When Section 42 gets lifted in the federal level in the next couple weeks and the border is opened up even more, we're going to be so inundated in Illinois, it's going to eat up our entire healthcare budget, crowding out all those citizens that need this quality care that they're deserving. These programs are going to be pushed aside to be covering this group.
So again, that's State Senator Dave Syverson from the Rockford area, raising concern that the growing cost of funding undocumented migrants' health care in Illinois is going to grow and eat away at spending for other programs. And that's a huge concern, especially when news came out in the past couple of days that revenue for April is down about $1.8 billion compared to April of last year, essentially erasing a lot of gains that were previously reported. So a lot of budgetary pressures moving forward, and it could get even worse, Syverson said, with a proposed bill that could expand the health care coverage for undocumented migrants even more.
By these numbers, we warned over and over again about this last year when they looked at expanding it, and they went ahead and did it. Last night, they also further talked about the idea of pushing legislation to further expand undocumented coverages from those ages 19 up to 42. That's going to be another, if they do that, another $400 to $500 million first year cost to our budget that we cannot afford. So clearly, there's a difference between what we believe Illinois should be and our priorities of taking care of our citizens, our most vulnerable population, before we deal with the national problem, which should be addressed in Washington in dealing with undocumented.
So we'll watch how this proceeds through the Illinois legislature with the budget process and playing out, and we'll know a lot more of those details as we get closer to the end of spring session, but a lot of moving pieces and a lot of spending expected from Illinois lawmakers. All right, stay tuned. Tons more to get to here with Springfield's Morning News. I'm Greg Bishop. Be sure to like, subscribe, follow, tweet out, whatever it is, Bishop on Air. That's how you can get a hold of me. Just search Bishop on Air, and we can connect that